Have you experienced any pain at all those first few steps in the morning at the bottom of your feet? I'm talking about like a dull, sharp, or achy pain that makes it very hard for you to start moving. But as you start moving, you're noticing the pain starts to decrease a bit. And you may not even have the pain just at the bottom of your foot, but you may notice the pain towards your heel as well. If you notice any of these symptoms, you may be experiencing something called plantar fasciitis. This is a very common foot impairment and can occur frequently in athletes, especially in runners. Women are more likely to experience and suffer from plantar fasciitis compared to men, and there can be several reasons as to why. Some basic reasons include some of the structural differences that exist between both men and women. Another major difference that we need more research on, but may have a significant impact, are the hormonal changes that women go through. We know that during pregnancy and during perimenopause and menopause, more women will experience plantar fasciitis compared to any other time frame within the female lifespan. That's something to take note of because during these time periods, our hormones are rapidly changing. So with this video, I want to make sure that you know there's some different things that you can do to help ease this pain. These are some simple tips and tricks I normally teach my patients and clients. And also I've worked with different runners as well, so that way they can help minimize and decrease this pain. Now, these are different things that I still maintain to this day, even though I have not experienced plantar fasciitis-based pain in several years. So even if you're not having the pain, this is something that can still help you to improve your quality of life and also improve your ability to do certain exercises and just function within a normal day. So first thing I'm going to show you is using a lacrosse massage ball. With a lacrosse massage ball itself, we're going to place this on the bottom surface of our foot and gently roll our foot on top of it. With these massage techniques, you're going to take it to your tolerance because this may cause some discomfort, but I do not want you to have severe pain as you're doing this. If you're noticing any numbness or tingling as you're doing it, I want you to go ahead and ease up on the pressure and or stop depending on the severity. But with the lacrosse ball, you can either do this sitting on the ground like I am, or you can do this with yourself seated in a chair. You're just going to place the foot directly on top of it and gently rolling the foot over those areas where you notice those tender spots. A lot of times you're going to have more tenderness on the inside of the foot towards that arch, and you want to focus there. Starting off, some people may even complain they feel something like a little crunchy or Rice Krispie at the bottom of the foot. As you're massaging and rolling, you can change the angle going more so towards the center of the foot, so directly in the middle. And you also can go towards the outside of the lateral portion of the foot. As you are adding pressure with this, you want to make sure that it is comfortable and that it's not too intense. As it starts to become easier, you can begin adding even more pressure or even change your position. There are some times if someone has good balance, good stability, and they already know that they're able to tolerate this, that I will allow for them to do this in standing, putting a little bit more body weight directly on top of the foot. Now, as you're performing this, I typically like to do 2 to 3 minutes on each foot. Why? Because previously I did have plantar fasciitis on both sides. If you only have it on one side, you can solely focus on that side, but it doesn't hurt to do both feet. Another method you can use, I'm still doing a massage, but you can use a log roller. With the log foot roller itself, this one actually has like little grooves and indentions in it. And this one can be really good at adding a more sensory-based cue as well. With this one, I can actually do both sides of my feet, placing one foot on each side. And I'm doing the same thing, just gently rolling and adding pressure. An alternative to this is you can freeze a water bottle, and sometimes a frozen water bottle will feel really good. And depending on where you are in the recovery phase of plantar fasciitis, it can also help with inflammation. If you're noticing that you're having more inflammation, then ice can help. So you want to try to do this. Ice, instead of using just the foam roller or log roll or lacrosse ball, you can try using the frozen water bottle. They do make little massage tools that you can place in the freezer as well for cryotherapy. So that way you can still get the massage based quality and also have that cold for inflammation as well. Even without inflammation, if you're someone who notices that cold just feels good on the bottom of your feet, go ahead and do that as well. With this one, I like to do it between 2 to 3 minutes each side. Because this one does have the grooves, when you're first starting off with those ridges, you may not be able to add as much pressure, and that is okay. You'll notice the differences between the ridges that the log roll can offer and that the lacrosse ball, which is smooth, can offer. They do make balls that offer you like more of a spiky type of ridge as well with a foot massager, which can be very beneficial for individuals. So that way they can get more of a pointed base contact. So after massaging the feet itself, what I like to do next is stretch. A lot of times we're not stretching enough and we can end up with tight calf muscles. We can end up with tight hamstrings as well. So we want to focus on stretching out our calves and our hamstrings when we have plantar fasciitis. The other muscles in the lower legs that you can begin to stretch, and also throughout the hips that you can stretch as well. But for this video, we're only going to focus on the calf muscles and focusing on the hamstrings. Because I'm already in a seated position, I'm going to move directly into stretching my hamstrings. So you can do both feet directly in front, keeping the back straight and then bending forward to grab the bottom of the feet or even the ankles depending on your flexibility. If you're noticing the knees are bending, you may not be able to go as far. Also, if you notice that you want to round the back, try to ease up a little bit so that way you can keep the chest upright and just bending at the hips as best as you can. Bending and arching at the back and bending the knees may be ways that your body is compensating due to lack of flexibility. So even if you're sitting up tall and you're only able to go just above the ankles, start there. If you're able to, please pull the toes back toward you as well, and you may notice a slight pull into the calf muscles. Some of that will be neural tension. Other portion of it will actually be the calf muscles that need to stretch as well. But with this stretch, with both feet in front, coming down, I typically like to hold for a minimum of 15 seconds, but working my way up to 60 seconds. So if you're able to start with 30 seconds right towards the midline of that, that's great. If not, start towards the lower end and work your way up to tolerating a full 60 seconds. And make sure that you're breathing as you're doing this stretch. With each stretch, I typically recommend that people do them 2 to 3 times each. And the good thing about the stretching and the foot massage is you can do them several times a day as you need to. Great. So the next stretch I'm going to show you, still for the hamstrings, we're going to go into a hurdle stretch. You're going to bring one leg back, placing the foot in towards the thigh. The other leg is going to stay out straight, and you're going to bend at the waist again. So not rolling at the back, but you're going to bend at the waist again to come down forward towards the foot. And as you're holding this position, same thing. You're going to hold for 15 seconds at a minimum. If you can make it 60 seconds, great. If not, start with 15 to 30 seconds. Just as I said before, I like to do things on both sides. So with this stretch here, I would do this stretch on both sides. And I would do this stretch 2 to 3 times as well. And just to keep it even for the video, let's switch over to the other side. Same thing, bending at the hips itself, not rounding the back, and try not to let that knee bend. Going down to where you feel comfortable and you feel a stretch. Even if you're stopping up here so that way the knee doesn't bend, that's okay. And we're just going to hold here. Remember, a minimum of 15 seconds. If you're able to make 30 seconds, great. If you're able to make 60 seconds, keep going. Good. And with each of those stretches, with first both legs in front and then each leg out, for the hurdle stretch, you can do both of those 2 to 3 times. Next, I'm going to have you stretch out your calf muscles. To stretch out our calf muscles, we can go to downward dog. So with the downward dog, you're just going to come up, bringing the bottom up, and trying to place the heels on the ground. If you're noticing that this is painful, you can also perform this stretch in standing, and I'll show you a way to stretch out your calves in standing as well, because we do not want you having any pain. And we're going to hold here for 15 to 30 seconds. If you can make it 60, great. You may also notice that as you're doing this, you can walk the feet, so lifting one heel as you push the other heel down into the ground to gently help stretch things out. Great. All right, and we'll go back down to the ground again. The next stretch, depending on how tight you are, is simply taking your big toe. With your big toe, you're just going to pull your big toe up. So now that way you have a stretch coming down towards the bottom of your foot. So pulling the big toe towards you. So that way you have a stretch on the bottom of your foot. And depending on how tight you are, you may already notice a pull. If you're not super tight through here, you may not notice any pull at all, and that is okay. But you can at least work on improving your toe extension, because we've noticed that individuals who lose toe extension, that they do have a tighter fascia at the bottom of their foot as well. And same thing, holding that there, minimum of 15 seconds, working your way up to 30 seconds and doing both sides. And you can repeat on both sides 2 to 3 times. Sometimes you'll see people at a curb, and with the curb, they'll place their toes on the very edge of it, or even on the step on the very edge, and then they'll kind of gently bring their heel down. And that is a way where you're able to stretch out both your calf muscle and the plantar fascia as you're doing this. Just make sure that you have something to hold on to, make sure that it's not painful, and also make sure that you don't fall. So keeping your balance, please, okay? Hence the need to hold on to something. Great. All right, so next we're going to switch to standing. And for standing, I'm going to show you how you're able to stretch out your calf muscles. We're going to do your gastroc and your soleus muscles in standing, and then you will be done with the stretching routine for plantar fasciitis, at least including your calf and your hamstrings. All right, so for the next stretch, you can either do facing the wall with the wall in front of you so you can place your hands there, or with the wall at your side, like I have it here for balance. If you don't need the wall for balance, great, but if you do, please make sure you use it. You're going to bring one leg back, and the front leg you're going to bend. The leg that is back, you're going to try to keep your heel on the ground. As you keep your heel on the ground, try to make sure you keep the knees straight. For the first stretch, we're going to stretch out your gastroc muscle, so the big calf muscle and the lower leg. With that, I'm going to have you maintain for 15 seconds at a minimum, trying to work your way to 30 seconds, but if you can, making it to a full 60 seconds. After you do one side, then you're going to switch to the other side as well. You may notice that one side is a little bit tighter, and that is okay. I typically have more tightness in my left calf, but because I hurt my right ankle a few months ago, my right ankle has actually been a little bit tighter for me recently. And same thing, keeping the knee nice and straight, bending the front knee, keeping the back leg straight, trying to push the heel into the ground and maintaining that position for your gastroc stretch. Now for the next stretch, we're going to do similar position, but now you're going to bend the back knee. As you bend the back knee, you're still going to try to push your heel down to the ground. As you're pushing your heel to the ground, you're going to feel the stretch a little bit lower. So the first stretch, you felt more up here. This next stretch, you should be feeling a little bit lower in a muscle called your soleus muscle and also your Achilles tendon region. Trying to keep your heel on the ground for that minimum of 15 seconds, working your way up to 30 or 60 seconds as you're able to tolerate. And then switching over to the other side. Same thing, keeping that back knee bent, pushing the heel into the ground. And you should feel it closer down towards the ankle region and down towards the heel. Good. And maintaining that stretch. With each of these stretches, I like to do them, like I said, for 2 to 3 repetitions on both sides. So that way I know that I'm getting a good stretch. Give these a try. Let's see how they help out your plantar fasciitis. But if you're noticing things not improving, please, please, please make sure that you see and work with someone. This is just something I've been able to do over the years to help me manage and prevent the symptoms from coming back. So I wanted to make sure I share some tips that worked for myself with you.